This meeting, I think we'll start the agenda. Usually I think we read just some advice for those who are planning to speak at the meeting. I think we can save that for just before we do that and go ahead with the agenda items first. First of all, just to approve the meeting minutes of January 3rd, 2022, our last meeting. I personally had no troubles with them.
I didn't either, except for one on page 2 under the request for variance for Ample School. There's a statement that you recused yourself from the hearing. And again, it wasn't a hearing, it was I don't know what it was. It wasn't really a petition. Was it a petition or a request or?
Probably a petition for variance, right?
Here's the meeting minutes.
Just to clarify it.
I'm sorry, where are you referring to again?
Page 2.
Just where it said, I think that I recused myself from the hearing. I think Sandy's just saying it wasn't a hearing, it was really more of a petition, I think a petition for a variance.
Right.
And
That's all.
so just that one change.
Other than that, I would motion that we accept the minutes as they are, as with that one correction, and the rest of the minutes look fine to me.
I'm still missing it.
And I'll second it right here, just where it says
Oh,
here.
from here.
Yeah,
I got you.
Yeah.
I'm looking up here.
Yeah. So I think it's just
I'll call it agenda item.
yeah, a petition for hearing, whatever, something, it wasn't really a hearing per se. But otherwise, I think the
There is a
minutes
difference.
are approved
As amended?
Yeah.
as amended. Steve, did you want to go ahead with the food and milk inspector appointment update?
If I could ask the board to table that for a few moments. I believe the food inspector is still out on inspections, and once he arrives, we'll do the appointment and introduction of the food inspector. But the Montechusett Public Health COVID response team is present with us. I'm pleased to introduce our epidemiologist, which is Victoria Selsa. She is present, and also our contact tracing supervisor, which is Catherine Hoover. She is also present with us.
Okay, super.
So if it would be okay, I believe Victoria would like to give a little update on the Montechusett Public Health COVID-19 response team, if
Sure.
that's acceptable to the board.
Yep.
Excellent. Hi, everyone. I hope you guys are all doing well. Like Steve said, my name is Victoria Seltzer. I'm the epidemiologist for the Montechusett Public Health Network COVID-19 response team, which I'll talk about in just a moment. But before I talk about that, I just want to give you guys an update on some COVID-19 data for the city of Fitchburg. There are currently 429 active cases of COVID-19 in the city of Fitchburg. For the time period January 9th, 2022 to January 22nd, 2022, which is the most recent reporting data from the Massachusetts Department of Public Health. The data is reported every Thursday by 5 p.m. So this data is effective as of last Thursday, a week ago today. The positivity rate for this reporting period in the city of Fitchburg was 22.03%, which is compared to a 15.33% statewide positivity rate for this same time period, and a 26.91% positivity rate in the city of Fitchburg from the previous reporting period, which was January 2nd, 2022 to January 15th, 2022. During this 2-week time period, which again was January 9th to January 22nd, there were 1,390 cases of COVID-19 in the city of Fitchburg, though I will emphasize that this number, 1,390, only reflects the residents who tested positive with a test at a lab. and does not reflect residents who only tested with an at-home rapid antigen test and did not get confirmatory testing, which from our experience so far is quite common. So I expect that number to be a little bit larger than that 1,390. Yes.
Do you want me to wait until you're through before I ask a question?
Go right
If I don't
ahead.
ask now, I might forget what it is.
Yeah, you can
So,
go right
no,
ahead.
I was just wanted to clarify the positivity rate from the 9th to the, well, from the 2 dates that you mentioned. It didn't seem like there was that much of a difference.
So the positivity rate from the 9th to the 22nd, which is the most recent reporting period, was 22.03. And the positivity rate from the previous reporting period was 26.91. So the most recent positivity rate represents a decrease of just about 4-ish%.
Okay.
And then the most recent positivity rate, that 22.03, is about 7% higher than the statewide positivity rate.
And you said we had 29 active cases?
We have 429 active cases
429,
currently, and that
okay.
number is effective as of about noontime today.
I wish it were 29.
Yeah, that's the 4.
Yeah, 429, as much as I would love for it to be 29, of course. So just something I want to emphasize, so like I just said, the positivity rate, of course, is on the decline, and that is representing in a lot of different data pieces, including wastewater data across the state of Massachusetts. But even though cases are on the decline, it still is very important to remain vigilant about masking in indoor spaces, testing when you're exposed or when you have symptoms, and of course, staying up to date on your vaccines, which I'll talk about in just a moment. So cases are decreasing, but we still need to be vigilant about all of our public health measures that we have in place currently. So now to talk a little bit about vaccination. So again, as of January 27th, 2022, which is again a week ago today, so that's the most recent data reported by the Department of Public Health, 60% of residents in the city of Fitchburg were fully vaccinated. Fully vaccinated defined as receiving 1 dose of the Johnson & Johnson vaccine or 2 doses of Pfizer or Moderna. So that 60% does not represent anyone that is boosted. This percentage of 60% is about 18% lower than the statewide average. And of course, we're continuing to work really hard to think of creative ways to bring vaccines into the community directly to our residents in the city of Fitchburg and increase the number of residents vaccinated to get a little bit closer to that statewide average. I was in a webinar earlier this week, and the presenter said, quote, "Vaccines don't save lives, vaccination saves lives." And I thought that was a really great way to think about it. I really liked that quote, so I wanted to share it with you all. And now to talk a little bit more about vaccination. So again, as of January 27th, 2022, 25% of residents in the city of Fitchburg have received their booster. This is, of course, a little bit lower than we would hope for. So I just want to remind everyone to get your booster as soon as you're eligible. In terms of eligibility, anyone who has received their second dose of Pfizer or Moderna on or before September 3rd, 2021, is currently eligible for a booster shot, which represents that 5-month time period required to be eligible. Emphasizing that 5 months because it recently was 6 months and it is now 5. So if you're between 5 and 6, you are eligible. And anyone who received the Johnson & Johnson vaccine on or before December 3rd, 2021 is eligible, which is the 2 months required. So Pfizer, Moderna, 5 months, Johnson & Johnson, 2 months. The other thing that is a really common question we get is if you're currently positive for COVID-19 or if you were recently positive. If that's the case, you can receive your first dose, second dose, or your booster as soon as you clear your isolation period. So the last thing that I just want to mention before we transition to talking about the MPHN COVID response team is to make sure that everyone is ordering their free at-home test from covidtests.gov. It's a really easy website to use. You just have to put in your first name, your last name, phone number, email, and your home address. Each household is eligible for 4 free at-home COVID tests that will be shipped directly to your home, and they can be ordered from this website like I just mentioned, which again is covidtests.gov. So if any resident needs assistance with ordering these at-home tests, they can give us a call, and our phone number is 978-602-2356. So anyone who needs help can give us a call, and we are absolutely happy to help. So now to talk a little bit about the MPHN COVID-19 response team.
Could I ask one question before you do that? I was just wondering what the statewide fully vaccinated rate is.
The statewide fully vaccinated rate is just above 78%.
So 78%, and we're in the 20s, did you say, or 30s?
So for fully vaccinated, the percentage in the city of Fitchburg is 60%, which again is one dose or 2 doses of the mRNA, Pfizer, Moderna. And statewide, that same data point is 78%.
Yeah. And for boosters, so we're in the 20% range, or high 20s, I think you
So
said.
for boosters, we are at 25%. I unfortunately don't have the data point for statewide, but I can certainly update you guys on that in the next meeting, or if anyone knows the statewide boost rate, you're welcome to hop in here. Yeah, but we're at 25%. I believe the statewide, and don't quote me on this because I'm not sure, 100% sure it's accurate. I believe it's hovering at around 50. Though, again, I'm not 100% sure on that, so if I'm wrong, my apologies.
You're doing great.
I think that's pretty close.
Is that right? Okay. Yeah, thank you, Steve. Okay, so now the Montechusett Public Health Network COVID-19 response team. So as we all know, the state contact tracing program transitioned the contact tracing responsibilities back to the local health departments effective as of December 1st, 2021. I almost just said 2020. We've been in this for so long, it feels like. So following this closure of the state contact tracing program, this MPHN COVID response team was established to provide COVID support for the entire Montechusett Public Health Network region, which of course is 13 communities and about 175,000 residents. Our hours, just so everyone is aware, are Monday through Saturday, 10 to 5:30 p.m. And we have staff that speak both English and Spanish, so we are able to serve all of our residents who need assistance. And again, our phone number, 978-602-2356. So that's the same number I shared a little while ago for assistance ordering those at-home tests. A data update on the MPHN team. So since January 3rd, 2022, which was our first day of making phone calls for the MPHN region, the team has called about 1,500 residents from the 13 communities who have tested positive for COVID-19. I do want to note that due to the current surge of cases across the state of Massachusetts, we are prioritizing calling individuals who are at the highest risk of adverse outcomes due to COVID-19, which would include residents who are over the age of 65, and also residents who haven't received COVID-19 vaccination just yet. Another thing that I just want to talk about is I think a really common misconception among the public and even myself before I started working in public health was what a phone call from the local board of health means or from the health department means. And I always thought that, you get a phone call, you're told that you're positive, and then your contacts are collected, they're notified, and that is the end of it. But on these calls, we're providing a really comprehensive support for our residents that are positive or who have been exposed. So we're providing isolation and quarantine instructions for themselves who are, of course, positive and also their close contacts. This is something that has been really appreciated by our residents more than you would think because these guidelines are ever so changing and it's very difficult for our residents to keep track of what they should be doing when they test positive or when they are exposed. We're also educating the residents about vaccination where applicable, whether it be if they need their first dose, second dose, or a booster. Something really common that we've been seeing, like I just said, is residents don't know that they're eligible for their booster. So a lot of times we're able to give the residents the good news of you can go get your booster shot, this is where you can go get it, and they are very excited to hear that, which is great to see. We also do some education around Mass Notify, which is a digital contact tracing tool in the state of Massachusetts. Educate them about treatments available for COVID-19, including monoclonal antibody therapy, and help the residents access treatment if they do not have a primary care provider or if they can't get in touch with their primary care provider. And this treatment referral process has been really great for our residents, not only in the city of Fitchburg, but also across the region. Athol Hospital has a self-referral option for monoclonal antibody therapy that I've been able to help residents out with, and I submitted a self-referral this morning for a resident who wanted treatment. I think I submitted it, I don't know, say maybe 9 o'clock, and they had an appointment and were scheduled for tomorrow at noon by 9:30 today. So that is something that otherwise wouldn't have been able to happen, that resident doesn't have a primary care doctor and doesn't have a computer to print out that form, fill the form, scan the form, and email it. So the resident is really happy to be receiving treatment. The other thing that's happening on these phone calls is coordination of resource referrals. So especially in Fitchburg and Leominster and also some other communities in our region, our residents are needing a lot of support to safely isolate and quarantine. And we're able to coordinate these resource referrals, which would include anything such as food, financial assistance, access to health care, such as health insurance and a primary care doctor. And these are things that a lot of our residents need help with, and it's something that will make an impact even beyond their isolation period or their quarantine period, because you don't just need a primary care provider or health insurance when you have COVID. You need it all the time. The other thing we're doing is helping residents schedule appointments for vaccination if they don't have access to a computer or if they have trouble navigating the internet. We had a resident the other day who tested positive and had been trying to schedule a booster for some time, but everywhere she called said that she needed to go online and schedule an appointment, and she doesn't have a computer and she doesn't know how to navigate the internet, so she hadn't been boosted, and then unfortunately she ended up testing positive. So for any resident that we speak to, case, or contact, we're able to schedule their appointments if they would like help. And then also, like I mentioned, we're also able to help the residents that would like assistance order those free COVID tests from covidtest.gov, which has been another much appreciated resource. The last piece of this is after these phone calls and after all of these layers happen, if they provide us with an email address, the resident will automatically receive a follow-up email from us that has PDFs of all of this information, monoclonal antibody therapy, booster eligibility, Mass Notify, and also all of the isolation and quarantine instructions written out so they have it. We're also working on coordinating comprehensive outbreak response to COVID-19 outbreaks that occur in our highest risk populations. Most commonly, we've only been at this for a month, so we've only done 2 site visits so far, but both of them have been in senior housing apartment buildings. The first one that we were able to schedule a on-site clinic in the community room of that apartment building, and we vaccinated, or I should say Community Health Connections, vaccinated 9 residents out of a 31-unit building, 1 first dose and 8 boosters, which was really great. So these outbreak responses, door-to-door outreach, distribution of test kits, we've been lucky to have availability of these iHealth test kits that many of our cities in the region have, distribution of masks, on-site clinics, education. So just a really comprehensive response to the outbreaks that are happening in our communities. So with that being said, just to wrap up, to let everyone know what happens if you test positive and what to expect. So if you test positive for COVID and you live in the Montechusett Public Health Network region in any of our 13 communities, you may receive a phone call from one of our staff members. If you don't receive a phone call from us, don't worry. You will instead receive a text message. This text message will have some information on isolation and quarantine instructions, what to do if you're positive, and it will also lead you to a digital questionnaire that you can answer some questions about what is currently going on. For example, when your symptoms started, if you've been hospitalized, if you have any underlying health conditions and where you were exposed. but it also allows you to request some resource support from the team, including if you need any resources to safely isolate or quarantine, if you need help getting access to treatment, or if you have any questions and you would like us to give you a call back, or even if you just want to call back to say hello. The responses to the questionnaire are confidential. It's not a scam, I promise. You can click on it. So yes, you'll receive, if you don't receive a phone call, you will receive a text. And the last thing to mention is if you test positive with a rapid antigen test at home and you don't get confirmatory testing, we want you to get the same resources that those who are testing at test sites are getting. So we've been working with all of the communities, including the city of Fitchburg, of course, to get the link to this form that I was just mentioning up on the city websites. So that way, if you test positive with an at-home test, you can fill out this form, answer those questions that I just mentioned, but also you can ask us questions, you can request support for resources, request support getting access to treatment. So that's been making a really big impact over the past week or so. We've been having a lot of residents fill out that form who we otherwise never would have been able to talk to. And it seems like it's been going really well so far. So I think that is all I have, if you guys have any questions.
Well, I'd just like to say thank you very much. It's very informative. It's great having you help us. I wish I could bottle some of your energy and take it home with me. It sounds to me as if individuals who are not getting fully vaccinated or boosted, when they have it offered to them, are fairly enthusiastic about getting it, and also for the monoclonal antibody therapy. It's just that for some reason, only 25% are finding their way to get boosted. And I don't know if it's for many reasons. Maybe they don't have transportation, maybe they don't have daycare, maybe, as you say, they don't have access to the internet. I guess that's what we have to work on somehow to get people to know that that's available to them, and it's not that bad an experience, and it's very helpful.
Yeah, absolutely. I think part of it is a lot of residents, and if I didn't work in public health, I wouldn't know either how important a booster is. And for many of our residents, it's not on the top of their to-do list. And in my experience so far with our residents, especially on these site visits that we've been doing for outbreak response, it becomes a priority, and getting a booster becomes more of a priority when it comes to you. So that is why this comprehensive outbreak response that we've been doing in our high-risk populations is so important. If we hadn't gone to that apartment building that I was just mentioning, the 31-unit one we did a couple of weeks ago, those residents probably wouldn't have gotten their booster anytime soon. The residents who were infected in that particular outbreak, the median time they were out from their second dose was 8 months. Mm-hmm. So they were, 3 months eligible at that point and hadn't received it yet. Not that they were against it or they didn't want to, just that they hadn't done it yet. This is a sad story, but we had a resident, I can't remember if they were a resident of the city of Fitchburg or if it was Leominster, but we had a resident who tested positive and was quite young. And she said that her work schedule was really busy and she wanted to get her booster, but the holidays were crazy for her and she just didn't have time. And she ended up getting COVID and unfortunately passed away from it a couple of weeks later. And when we spoke to her, her symptoms were pretty mild, and unfortunately it took a turn about a week in, and she was hospitalized and later passed away. So. And
she had two doses of... 2
doses, but was quite far out from her second dose and hadn't got her booster yet.
Yeah.
So, that's just really goes to show getting your boost is very, very important. We see this a lot in the data that we're working with and the residents that we're talking with and, stories we hear. So getting the boost is very important, and we will definitely continue to work very hard at, making it as available as we can for anyone who is eligible and wants to get their boost.
Well, I don't want to keep you a long time here, but it just sounds as if you have a staff of maybe 25, 30,000 people to do all the work you're doing.
That'd be great. We have a small but mighty team. It's myself, Catherine, and we have 8 case investigators. I'm trying to be very careful in not calling them contact tracers because, like I said, that word I don't think is very representative of what we're doing, and I want to make sure they're getting the credit for all the hard work that they're doing on the phone with these residents. I think I told this story at the city council meeting a couple weeks ago, but that site visit that we were at a couple of weeks ago, you start to kind of have the residents are having a lot of trust in us, and it's happening very quickly because of these conversations we're having with them on the phone and in person when we're doing these site visits. And we had a resident call us and say, "My toilet is broken. Can you come and fix my toilet? I can't get in touch with my apartment manager." And it's like,
I have to tell you though, Victoria, that lady, I know who you're talking about.
Do you?
Because she had us fixing that toilet too when we were doing the calls.
yeah.
So
Absolutely.
You're just a new person that can fix her toilet.
Oh, I mean, she got new person, old person. She got her toilet fixed, so that's
Yeah,
great.
She gets it fixed quite frequently. I don't know what she does to it, but.
Yeah, I don't know, but so we have myself, Catherine, we have 8 case investigators, and then we also have a care resource coordinator coming on board, a very, very welcome new member of our team. Catherine and I have been doing the care resource coordination on our own for the past month, which is a challenge, but we're making do, and this is what we're here for. So we have a small but mighty team. All of us but one are coming from the state contact tracing program, so we've been at this for 2 years now, and we have a lot of experience, so we were able to really hit the ground running when we came on board at the beginning of January and start supporting the community as much as we can. So I wish we had 25,000 staff. That'd be amazing.
It sounded as if you did. And I'm just wondering, do you have an office someplace, or where are you based, per se?
So we are all working from home.
Okay.
The plan was for all of us to be fully remote, though I quickly realized that public health works a lot better sometimes when you are right there on the ground and in person. So both Catherine and I have been doing some on-site work about once a week, and primarily through site visits. So we don't have any office here at the city of Fitchburg, but we've been bugging Steve and sitting at his little table in his office when we come to City Hall. So yeah, we are fully remote.
And lastly, and again, I don't want to take everyone's time too much, but can you tell us briefly what you were doing before you became involved with this, what your background is?
Before Fitchburg or
Yeah.
before the CTC?
Before you started this, serving on the COVID response team and doing this sort of work,
Okay, yeah, definitely. So like I said, all of us, including myself, just came from the Community Tracing Collaborative. I started there right at the beginning of the pandemic. My first day was April 17th, 2020, which was about a month in. I started as a contact tracer, and the same for Catherine. Started as a contact tracer, became a case investigator eventually, and then transitioned over to a team that was newly developed called the Epidemic Intelligence Unit. And this team essentially served as the epi support for the entire state of Massachusetts. So we weren't region focused. We were working with cities and towns across the state. I worked with Steve and Dottie quite a bit on some things that were going on in Fitchburg. A lot of outbreak response, data analysis, and everything of the like. And Catherine, I don't want to speak for her, but she started same as me, contact tracer, case investigator, and then became a supervisor and had a team of between 20 and 25, 30 case investigators underneath her until the contact tracing program closed up. So that's where I come from. I graduated from UMass Amherst with a bachelor's degree in microbiology at the September of last year, 2021. Yeah. 2021.
Just a kid.
Yeah, I was supposed to study abroad last fall, and I was supposed to graduate May 2021, May 2021. I'm getting all the dates mixed up, but ended up graduating a year early because of the pandemic. So
Well, it's wonderful having you help us, and it sounds like
you.
you're very capable, and so we appreciate all you do, and thanks so much for coming in and telling us about what you do.
Absolutely.
Jacqueline, did you have a...
Yes, I've been coming to the Board of Health meetings for a while now, and they usually don't start right at 5 p.m. There's usually a little delay, so I've noticed in the past that Mr. Curry would often use that time to pull the current week's data, which is released at 5 p.m. on Thursday for the cities and towns. So hopefully that's something you can do in the future. 22% positivity sounds high. I don't think it's anywhere near that now if you look at the data that was released today. I haven't looked at it myself, but that's my guess. I know as of yesterday, the state positivity rate was down in the single digit, 6-point-something%. So, we're definitely moving in the right direction.
How much did you say it was?
The state level was 6-point-something% yesterday. Yeah.
I actually looked at it before we walked over. It was 16.5.
For us in Fitchburg?
16.5. So we
Okay.
had somewhere around 960 cases, and there was somewhere around 5,500 tests.
As compared to the 22nd or the 29th of January, that's what you said, Victoria?
Yeah, it was January 9th to January
22nd?
22nd, 22.03%.
Okay, so that's about, what, 2 weeks?
They're reported in 2-week time periods, yes.
Yeah.
Yeah, 2-week time periods
So
every
it's come
Thursday.
down to 16. in
16,
2 weeks.
yeah.
And yeah, I can see that.
Yeah,
That's
hopefully,
great, thank you.
hopefully this is a nice trend for Omicron starting to taper off a bit. We'll see how it goes, but it's optimistic. Well, again, thanks so much for taking the time to come in and tell us what you do. Did you want to go?
We'll go backwards.
Yeah,
We should do the,
to the food and milk inspector.
okay.
Is that Sean?
Yeah,
Sean Michael Tantinarot.
Tintinarowat. So I would just like to
Is that a time?
introduce Sean Michael Tantinarowat. He started on January 3rd. He has done some training in some towns. He's also spent some time with a few food consultants. But he's done a wonderful job thus far, and he's like a sponge. He's very receptive to information. He also has much kitchen experience with his previous employment. So folks will see him wandering around. He's actually working on his food permitting systems, and he's reaching out to those folks that have any questions about their food licenses and facilities. So I introduce and welcome Sean Michael Tantinarowat.
Thank you.
It sounds like a Thai name, is it?
Yeah, spot on, yeah. Surname's Thai.
I spent a couple of months working in Thailand during medical school, so I'm kind
Nice.
of used to those names. Well, we have lots of restaurants opening up, and you probably know better than I, lots of things happening, so wonderful to have you to look into it and keep us all healthy.
Thank you. I've met quite a few operators already, and the establishments have been very impressive from what I've seen, so I'm happy to be here. I'm looking forward to a
Super,
good
welcome.
year.
An official appointment would probably be
Yeah.
a good idea.
Yeah.
Should we vote on that?
Yes.
So I'll motion that we make an official appointment for Sean Michael Tantinarowat as food inspector for the City of Fitchburg Board of Health.
And I'll second that. Welcome. Thanks.
You are officially official.
Yeah, you're official now, Sean.
You're in trouble now. Number 3 on the agenda is annual chair appointment. What does that have to do with?
That's probably a good thing to table for the next meeting.
Yeah, every year
Full quorum.
we have to appoint the chairman.
Okay,
Okay, so we should have Ian here.
all right, fair
I
enough.
don't think you have anything to worry about, but,
Well,
and I don't know nobody else wants.
I don't know which way I should worry.
You're not fired tonight.
Yeah, so you're not fired tonight, and no raise tonight either, by
You
the
get
way.
30 more days of life.
Yeah.
Yeah,
Well, number 4 on the agenda is the COVID-19 update. I think we've essentially done that.
Yes, the only thing I would add to that is the clinics. As far as clinic goes, folks are welcome in this building on Fridays from 12 p.m. to 6 p.m. Every Friday up until the end of November, or I'm sorry, Friday, February 18th. We will be holding clinics for boosters and first shots, as well as seconds. Second doses. Tomorrow, we have been forced to cancel the clinic due to poor weather and poor sign-up, so folks don't walk in tomorrow, but Saturday, the following day, this coming Saturday, the clinics will operate from 10 a.m. to 4 p.m. There is a link on the website to sign up and make an appointment if you wish, and you also may walk in. And those clinics, as I said, will run on Fridays and Saturdays up until February 18th, thus far. More information on expansion of that. As far as testing sites goes, our testing site is still located at the airport. The testing site is running from Monday to Thursdays from 12 to 4. It is a PCR test, and it's gone from 300 to 400 testees a day to about 50, so it's gotten quite quiet. So folks are encouraged to utilize the test site. You enter the test site from Airport Road to Crawford Street to Blueberry Lane to Cobbler Lane. Sounds complicated, but it really isn't. Just don't enter the airport. It's actually the entrance off of Blueberry Lane, which is directly off of Crawford Street. And that covers that.
Good enough. And nothing requires any further vote or
Correct.
consideration. So number 5 is a request for variances. New Pro Homes, 117 Constitution Drive.
So it doesn't sound like New Pro Homes was able to make it to the meeting this evening. The option, this was a request to reduce the plumbing in a condominium, which is 117 Constitution Drive. This gives you a little taste of how antiquated plumbing codes are. The Board of Health actually still has to grant variances as well as the Mass Plumbing Board. But this particular homeowner wishes to replace his existing tub with a walk-in shower, and they are unable to put the proper size drain in, so they will be installing a 4-inch threshold pan and also installing a restrictive shower head at 2.5 gallons per minute to help with the variance. I did speak to the plumbing inspector as well as the building commissioner. Neither of those individuals have any concerns over this.
Well, what does that mean when you have a 2.5 gallons per minute? Is that what
Yeah.
that is? Is that a slower rate?
It is.
That's what I thought,
It's
okay.
a energy efficient, water efficient shower head, so basically it reduces the amount of water.
Okay,
And a threshold pan would be something to prevent overflow from the shower, is that on the floor?
Correct.
Yeah.
Yep. Rather than the normal bathtub drain.
gotcha.
Is this something that we need to have New Pro?
I don't think it's pressing, but I didn't want it to become pressing in March. We can certainly,
I guess what I'm
Hold
saying
off.
is we shouldn't vote on it now then. without-
if there is no issue with it, I don't think it's pretty easy over, it's not a big deal. We can either take care of it now or save it for a presentation in March? November.
Yeah.
But it doesn't seem like a long presentation is really necessary.
It doesn't seem to me that they're going to be flooding Constitution Drive, based on that change.
No
And,
pun intended.
No. And so I'd be in favor of granting them the variance. I would make a motion to grant the requested variance to change the existing tub for a walk-in shower.
If we grant the variance, is there anything that we need to follow up with them on as far as like we do with septic systems to have, there's no testing that has to be done or anything like that, right?
No, but the plumbing inspector would have to approve the job, so we
Okay.
could get a report from the plumbing inspector on how things are functioning.
Well, how often does he have to inspect the job? What do you mean, he inspects it when it's installed?
Correct.
Okay, well, I would second that motion then to approve the variance on Constitution
There is a
Drive.
condition, you are certainly able to put a condition on that, if that's something you have a concern with.
Well, I'd like to kind of make sure that, I'm not really up on the plumbing code either, so, but I just hate to have something come back and happen that, maybe we shouldn't have done this. I mean,
How would you follow up on this? I mean, we have to go in and watch someone take a shower or something? How does that work?
Well, whoever doesn't show up for the next meeting has to be the person that takes a shower. They
Okay, I guess I'm-
they could actually do an inspection and see how the flow works and a matter of time, gallons per minute, matter of time, how much water is released from the shower head and how much the drain can handle. But that would be the routine job of the plumbing inspector anyway.
okay, so if anything did happen, like, I don't know what it would be, but it would kind
So
of fall on the
you could
plumbing
put a condition
inspector?
on it that we get a report from the plumbing inspector after he inspects it. Any concerns he has, or,
Yeah, that might be a way to do it, just once it's inspected, just to be sure that there are no concerns that are present.
Okay, well,
not making you feel comfortable?
no, I'm not comfortable because I don't know the plumbing code.
plumbing
And I,
inspector?
don't feel like I'm qualified to even
Well, welcome to my world.
approve a variance.
I think the implication
Okay.
is that there's supposed to be a 2-inch drain.
Correct.
For a walk-in shower, but for some reason, because of the location, they can't do it.
Yeah.
So they want to just cope with that by decreasing the amount of water flowing out of the
You
shower.
make it
and
sound
putting up
so
with it.
easy, John. You just, I'm better with septic systems than I am with that. So I would second that motion with the exception that maybe we get a report from and Steve can confirm that it's operating the way it should be based on the report from the plumbing inspector.
I would agree with
Is that okay?
Yep,
All
that
right.
sounds fine.
So it's all on you, Steve.
Just trying to save them,
Yeah, I'm sorry. I'm just not up in on the plumbing code stuff.
Be sorry, that's your job as a legislator.
Okay.
Okay, so that, you'll let them know that and be set there.
Produce some sort of documentation that hopefully will satisfy your need. If not, we'll call them for us. Not a problem.
So the last and number 6 item on the agenda is a petition from Jacqueline Wetchy, petitioning to rescind the entire Board of Health mask mandate adopted August 5th, 2021, and amended on August 25th, 2021, as outlined in the petition. I think I should just read the instructions that we have for opportunities for the public to speak during a Board of Health meeting. The chairman will ask if anyone in the audience wishes to speak on any matter appearing on the agenda. I presume, Jacqueline, that you do wish to speak on it since you're here and you've provided us with some paperwork. If you wish to address the Board of Health, you must stand and be recognized, or if you're more comfortable, you can sit and utilize the microphone there. And follow these rules before speaking. We want your name and address. I don't think we need your street address, just your city of residence. You can either stand or sit while speaking so that we can hear you. We've got these speaker things that are very helpful to us. You can only speak on items appearing on the agenda and for no more than 2 minutes. I think 2 minutes, I know you've got paperwork and you've got things to say, so we'll certainly be lenient about that. We're not going to time you, but within reason too. And the petition, order, ordinance, or resolution number to which you refer, I think we know it's about rescinding the mask mandate. So I'll let you go ahead and speak.
Okay, at previous meetings, Mr. Murray has presented or referred to studies which he says justify mask mandates. One of them was from Johns Hopkins University. Yesterday, they released a study which showed that the lockdowns done in the United States and Europe, in which people had their businesses shut down, lost their jobs, and children were not allowed to attend school, didn't work. They had no measurable impact on COVID-19 mortality rates. I hope that would give you a little pause and make you realize that you can't regulate your way out of a public health emergency. His studies also predated the Omicron variant, which is extremely contagious. It has even escaped quarantines, and I have information on that on the second page. It's so contagious that according to numerous public health officials, such as Dr. Fauci, Dr. Woodcock, and Dr. Jha on the following page, everybody's going to get it. Trying to stop Omicron with masks will not work. Vaccines and not masks are the solution. You turn to the following page. I have some data from the CDC on the antibodies to COVID-19 that were found in blood donors, which shows our community immunity, as it were. Turn to the following page. This study was done in November 2021 before the Omicron surge, and at that point already 93.9% of people who donated blood had antibodies to COVID-19 in their blood. Now we're probably close to 100%. If that's not herd immunity, I don't know what is. So we're all going to get it, and the masks aren't going to keep us safe from it. Additionally, your mask mandate is unjust because it's being applied unevenly. The people who lead the city should be setting the example, and they're not following the mandate themselves. If you turn to the following page, you will see in this very room, which is in a municipal building, 2 city employees, the mayor and one other, not 6 feet apart, but standing shoulder to shoulder, not wearing masks. The Declaration of Independence says we're all created equal. If you're not going to enforce your mandate equally, it's unjust. Everyone should have a right to control their bodies, including their face. It's not just the people in the city who are politically powerful, such as the mayor. Now, I understand there are many people who are nervous and concerned still about COVID. The last thing I've included is an article from 3 prominent Massachusetts doctors, one from Tufts University School of Medicine, one from Harvard Medical School, and one from the BU School of Medicine. They are proposing what's known as one-way masking. As you know, this week already, the free N95 masks sent out by the Biden administration are reaching the shelves in local stores. Anyone can go and get 5 free N95 masks. If you're worried about COVID, you can put on an N95 mask. It's the same type of mask that medical providers in COVID wards wear when they're around COVID patients all day long. That can keep you safe. You can get your vaccine, you can get your booster, you can get your free N95 masks. If you're worried about COVID, take that level of personal responsibility for your health rather than imposing a mandate on everyone else, which is unjust and unevenly enforced.
Well, I think that as is becoming evident, the rate of COVID infection seems to be going down. On the other hand, I think the Massachusetts Department of Education is still requiring masks in the school until the middle or end of March. I think that that is supported by parents and teachers there.
You sure it's the end of March? I thought it was the end of
It's
February.
February 28th.
Is it February? Okay.
Yeah, and
February,
then they'll
all right. So
reassess it.
It's an, okay, reassessment.
That's what I thought I saw
Okay.
too.
When you get on an airplane, you need to wear a mask. They won't let you get on, or if you do and you take your mask off, they'll take you back to the terminal and take you off the airplane. Fitchburg State College or University is allowed to eliminate mask use because they've achieved actually a 100% vaccination rate, more than 80%, but they have asked to continue it. Likewise, the library, the place that you commiserate with or say...
If I may, are you familiar with the statement that was made by Mary Lou Sutter, which is the State Director of Health, regarding universities? She sent a letter out to them telling them, hey, why don't you ease up on these restrictions? Basically, 100% of your students are vaccinated. This isn't necessary. And that's the highest health official in the state of Massachusetts is saying that.
I'm not debating that. I'm just saying Fitchburg State has said they don't want to eliminate use of masks. I think it makes them feel safe. When you go into a restaurant, you still have to put a mask on. So I think that we're still kind of feeling our way with these viral infections, with various variants that are coming along. And I still think that, there's some optimism there as Omicron seems to be subsiding, and maybe we won't see variants, and maybe we will do better. And I think when that happens, we'll all be very happy to be rid of masks. None of us likes wearing them. But I think until that happens, I don't think it would be proper for Fitchburg to say, especially based on all the work that these folks are doing, to say we're going to let you stop wearing masks, whereas airplanes, restaurants, the governor, all of the state organizations seem to be favoring mask use. And for Fitchburg to say, we know better than you, and we're not going to make you do that, I don't think is the proper approach.
Actually, the governor's not saying that. People have been trying to lobby him to enact a statewide mask mandate, and he's refused. He says it's not necessary.
Well, I think he's recommending it, at least as last I knew. So I continue to think that the mask mandate, as we've had it, should remain in force. We have not penalized people who don't do it. I know that we have said that we would, but I don't think we've issued one penalty at all. We don't have people going around, pointing out to individuals that they're not wearing masks. This is not really a Gestapo approach. We're just trying to do what is best for the health of Fitchburg. Nobody has the complete answers with regard to the science, but it's better to err on the side of safety, I think, than to err on the side of carelessness.
What about erring on the side of freedom? That has no value?
I think that when you don't wear a mask and you go into a place where perhaps a person hasn't been vaccinated, or you go to a place where there are children who are under the age of 5, you're taking away their freedom. So I think there comes a time when, the United States have to be united and act in terms of what's best for people, not that one person might have felt faint in a library during the summertime. That's not really what it's about. So I'm going to make a motion that we continue the mask mandate. We will certainly reassess it. There's going to be apparently a reassessment at the end of this month by the Department of Education. If they say we don't need masks, they're no good, it's not helpful, enough people are vaccinated, there's enough herd immunity. If that all happens, then certainly we'll consider it. But I think until that does happen, I'm going to make a motion that we continue the mask mandate as it is.
Yeah, I would like to also say that I haven't seen any municipalities that have taken away mask mandates at this point.
Beverly's, they took it away effective at 11:59 p.m. yesterday.
And why did they do that? Was there a reason they did that?
Because we're past the Omicron surge and it's not needed.
I didn't know that. I know that there are other municipalities in the MPHN that have mask mandates. I think we're headed in the right direction right now, but I think if we take it away now and then we get another variant, that crops up and we have another surge, then we're right back where we started from. Maybe the next thing we should look at is making the mask mandate optional. I don't know.
Well, I would agree with that, but we're not really penalizing people who don't wear it. So if you say, I'm going to walk into the library without a mask, or I'm going to walk into a municipal building without a mask, I suppose you can do that. I doubt you'll be penalized for it. People might look at you and say, gee, you shouldn't, just like I guess you looked at the mayor recently and said, gee, he didn't have his mask on for a photo shoot. But I think that, we're not, as I say, we're not here to make people's lives miserable. We're here to do the best we can to protect the people of Fitchburg, and we're essentially just doing the best we can at that.
You say you're not here to penalize people, but the last meeting you refused to remove the penalty portion of your mask mandate. You got a $300 penalty on the books, which you could slap on anyone if you want to. And for a point of comparison, Keene, first offense, a warning, second offense, a warning, third offense, $300 fine, fourth and any subsequent offense, $250 fines. You start right out with $300. And I asked you to repeal the penalty portion of it, you wouldn't do it. And you're not imposing it on the people like the mayor who make a good salary and could afford to pay it, but you're keeping it on the books. What, so you can use it against ordinary people? It's just wrong.
We would do to the mayor like we would do to any person walking the street, and the mayor, we've had a conversation actually with the mayor. He's aware of the fact that he didn't have a mask on, and he was he was found out. So he knows now. I don't think you'll see it happening again. Nobody likes the mask mandate. Nobody likes wearing a mask. But anyway, I would second that motion, so.
Yeah, I'll say granted, it's on the books, I guess, but it's never been levied, so no one has encountered that fine. You didn't confirm, but I'm assuming it's so. You live in Fitchburg, do you?
Yes, I do.
Yeah, you do, okay. Just out of curiosity, how long have you lived in Fitchburg?
I have lived here for over 24 years.
Yeah, and have you ever served on any committees, or have you participated in any ways to help the city? I know you come here on a monthly basis and you have criticism, and I'm not saying it's unhealthy or it's bad. We're certainly ready to respond to it, but I'm just wondering, what have you done yourself to serve or to help the community?
Well, one thing I've done is over the time I've lived in Fitchburg, on 4 different occasions, I've had homeless people come and live in my home who needed a place to stay. That would be one example.
Okay, that's something you do personally, but have you ever served on any city committee?
No, I have not served on any city
Okay.
committee.
Great, okay. Well, I think we've passed we're going to continue the mask mandate as is, and I think the last item in the agenda then would be
That's it.
conclude the meeting.
Make a motion to adjourn.
Anybody else have anything to say, or? Then I will adjourn the meeting.